Hi, I'm Vicki Ruffing from the Johns Hopkins Arthritis Center. This video discusses ways to take control of your psoriatic arthritis. By learning more about your disease and treatment, you will be better equipped to make informed treatment decisions. You've tuned in to video 3, Taking Control. When you first see your rheumatologist, you will work together to develop what's called a treatment plan. The goals of the treatment plan will be to relieve pain, to reduce inflammation, to stop or prevent joint damage, and to improve function. Treatment plans are not all the same for all people. Because each person is unique and their psoriatic arthritis is unique, your rheumatologist will work with you to develop an individual treatment plan. The treatment plan will contain a combination of medications, lifestyle changes, monitoring and ongoing care, and there may be a time where you need additional interventions, such as physical therapy, occupational therapy, or surgery. Let's first discuss medications. Non-steroidal anti-inflammatory drugs, or NSAIDs, are useful against pain and inflammation. However, they will not stop the progression of psoriatic arthritis, meaning that they will do nothing to change the disease or prevent damage. NSAIDs are available over the counter or by prescription. Examples of NSAIDs are ibuprofen, naproxen, Motrin, Aleve, Advil. There are some side effects associated with NSAIDs. Stomach irritation and sometimes serious gastrointestinal problems, such as ulcers, could occur. Daily use of NSAIDs requires monitoring by your rheumatologist. You may have blood tests to check your blood pressure and also your kidney function. Tell your doctor if you have kidney disease, heart disease, liver disease, high blood pressure, asthma, or peptic ulcers. The next group of medications are steroids. These are called corticosteroids and are used to relieve inflammation and reduce swelling. They provide relief quickly, usually in a day or two, but they should not be used for long periods of time because of their side effects. Corticosteroids are typically used to control a flare of disease, or they may be directly injected into a joint or a bursa sac. Examples of corticosteroids include prednisone, triamcinolone, and solumedrol. The side effects of long-term use of steroids include increased appetite, osteoporosis, mood changes, fragile skin, easy bruising, fluid retention, weight gain, onset or worsening of high blood pressure, diabetes, cataracts, high risk of infection. You should be monitored for your blood pressure, blood sugar, osteoporosis, and other side effects while you're taking these medications. Medications used to control psoriatic arthritis are called disease-modifying anti-rheumatic drugs, or DMARDs. These drugs are treatments which change the disease and the course of the disease. They may be used alone or together, and once you start these medications, it may take weeks to months for them to take effect. About 70% of people with psoriatic arthritis and inflammatory arthritis use these drugs. Common DMARDs are methotrexate, hydroxychloroquine, sulfasalazine, or leflunomide. Some effects of DMARDs are eye problems, which are very rare, headache, loss of appetite, nausea or vomiting, diarrhea, hair loss, skin rash, mouth ulcers, fatigue, and kidney or liver damage. Monitoring by blood work several times a year will cut down on these side effects. Report any other side effects immediately to your rheumatologist. Another group of medications that work directly on your disease are called biologic disease modifiers. Specifically, those called TNF inhibitors are approved for the treatment of psoriatic arthritis. These work by blocking parts of your immune system to stop the inflammation process. Many times these are used in combination with DMARDs, such as methotrexate. You should never be on more than one biologic disease modifier. These can be given by an injection or by a needle, which you can learn to use yourself, or by an IV infusion, which means a nurse has to put a needle in your vein and let the medication run in. These medications can be very expensive. You should check with your insurance carrier about coverage. The biggest side effect of biologic medications is an increased risk of infection. Because these drugs change the immune system, you may not be able to fight off infection as easily. There is also the possibility of a reaction to the infusion or the injection. If you have a history of hepatitis B, there is a chance that it could reactivate while using these drugs. Monitoring also includes a screening for tuberculosis before beginning any biologic disease modifier. You and your doctor should be on the lookout for any signs of infection. Lifestyle changes may help you take control of your disease. You should be careful when using alcohol, as there are some medications that should not be used with alcohol at all. You need to find a good balance between rest and exercise. Learn ways to protect your joints, and try to avoid too much repetitive motion, which can give frequent stress to the joints. Other therapies may include orthopedics for joint surgeries, physical therapy for strengthening, occupational therapy for splints and adaptive equipment, psychology for counseling and coping skills, and nursing for disease education. Working in partnership with your rheumatologist and healthcare team will determine the best treatment plan for you. Ask questions and discuss side effects of medications. Recognize that ongoing care and monitoring will be needed even when you have little or no pain. Continue to learn about your disease and treatment options in order to make the best treatment decision for you. Thank you.